What we're going to do is apply a thick layer of ultrasound gel in the infrapatellar margin and actually float the probe in that layer of gel, not coming into full contact with the patient's knee, because there are two bursa immediately beneath the skin, and they're labeled here as A and B for you. There are two subcutaneous bursa. A is a prepatellar bursa, which is attached to the patellar bone. B is the infrapatellar bursa, that's a subcutaneous but slightly distal from the prepatellar bursa. So two small subcutaneous bursa immediately under the skin, which is why we need to initially float the probe before we come into full contact, because you can very easily compress those bursa out of your view and miss that diagnostic finding. So initially, infrapatellar, float the probe in a layer of gel, take a look to see if there's any fluid in these very superficial bursa, and then once you've ruled that out, then go ahead and settle in with a more full-face probe contact. So this is the probe fully settled in after we've ruled out the presence of those bursa. And now we're going to take a look. We're going to find our bony landmarks of the patella proximally. So this is proximal, this is distal. So we find patella with the patellar tendon or ligament extending out across the joint. Now this ultrasound image that's on the slide is a panoramic view. You're probably not going to, on a standard examination, be able to see the patella and the tibia in one image. So you probably just see the patella here and the tendon extending across the joint, and then you want to trace or follow that tendon all the way across to the tibial tuberosity so you can get an idea of the integrity of the entire length of that tendon. The other anatomy on this image, deep to the patellar tendon, is Hoffa's fat pad, these mixed echoes that are deep to the hyperechoic fibers of the patellar tendon. And a little bit obscure on that image, the round convexity here, that is the femoral condyle, labeled as FC for you. So still in the area of the patellar tendon, we're going to look at another bursa. This is called the deep infrapatellar bursa. So this is the third one on this one image. So it's an easy image to get, to look at the patellar tendon. But you have to remember there's three bursa that we have to evaluate along with this very simple image. So the deep infrapatellar bursa is underneath or deep to the patellar tendon or ligament and anterior or proximal to the tibial margin. All right, so it's deep to the patellar tendon that we just talked about, but it's slightly anterior or proximal to the tibia. This is the bursa that's involved in young adolescents in the condition very popularly known as Osgood-Schlatter. So a young adolescent individual with anterior knee pain, you want to make sure you're taking a good look at the deep infrapatellar bursa. So what does it look like? Again, the bony landmarks guide us to that bursal interface: proximal, distal, patellar cortex shadowing deep to it, femoral condyle here. This is all patellar tendon, and then at the deep infrapatellar region of the tendon here is the area for the deep infrapatellar bursa.